Week, an important time to get in tune with your body, and taking care of your spine is a key way to maintain a healthy and functioning body. Joining us today to talk about spinal health is Dr. Subramani Seetharama, Chief of Physical Medicine and Rehabilitation at Hartford Healthcare. Doctor, welcome.
Thank you for having me.
Thank you for being here. So talk to us about spinal health. Why is this important?
So every one of us has had back pain or neck pain at one time or the other. That's the second most commonest visit to your primary care physician. And it affects your daily life, it affects work, it affects, if you're a golfer, if you have back spasms, you can't play golf, right, during the summer. If you watch football, Mac Jones, the quarterback, was almost a no-go for the Sunday because he had back spasms. So it's really important to manage your health and manage your back and your neck so you don't get into trouble with pain.
Doctor, what are the most common spine conditions?
So, like everything else, as the body kind of wears and tears, you get arthritis. Like you get arthritis in your hips and your knees, you get arthritis in the spine. You get stiff. Your posture gets worse. So we have what we call a spondylosis, which is arthritis of the spine. You can get spondylolisthesis, where there is instability in the spine. And what everybody talks about is sciatica. That is a generic term for a disc herniation causing radiating pain. And there is another thing called spinal stenosis, which older people get. When you're walking, you get pain in your legs. So those are some of the common conditions that you can have when your spine starts to wear and tear.
All right, doctor, talk us about how can someone maintain a healthy spine?
So what I tell all my patients is what the American College of Sports Medicine says. You should stretch every day. And I prefer if you stretch when you get up in the morning because you've been sleeping for about 8 hours and your body is stiff. You just need to do a 15-minute exercise working on spine, and your physical therapist, shout out to them, it's Rehab Week, can show you some of those exercises. Whenever you play or go work out in a gym, you should stretch after that. That is very, very important. And then 2 to 3 times a week, either you can work out in a gym or at home with light weights and doing some strengthening exercises. And we call it the core and upper back strengthening. And so those are some of the things that help your fitness, help your aerobic capacity, and also keep your spine healthy.
All right, doctor, final question. What are the types of treatments available at Hartford Healthcare Spine Centers?
So I'm very proud of Hartford Healthcare, where we have this non-operative spine model. We have spine wellness centers in New Britain, at Charlotte Hungerford, at Fairfield County, and we are starting to open one at Wyndham. It is basically a triage where you walk in and see a physical medicine and rehab doctor like me if you have back or neck pain, and we will triage and diagnose you and figure out what is going on, and it is all non-operative management. You will go to physical therapy if you need it. If you don't get better, you need imaging and injections. We have doctors who do injections. And obviously, we have our colleagues, the neurosurgery and orthopedic spine colleagues, who work with us in case you need any kind of surgery. That's the kind of treatment, the access we provide to the patients. 80% of back pain is non-specific back pain. It is not related to your spine. It's related to your joints. It can be easily treated by your physical therapist. And so that's where you should concentrate on getting your care.
All right, Dr. Subramani Seetharama, Chief Physical and Medicine and Rehabilitation at Hartford Healthcare. Thank you. Great information.
Thank you.